Our Students in Medical and Health Sciences Education Initiative, known as SIMSE, is unique to HKUMed. The idea developed in 2019 when we invited students to design and improve the medical curriculum. Today, we welcome students to actively participate in teaching and curriculum development. Teaching is a key responsibility of medical doctors and other healthcare professionals. So SIMSE helps students develop these vital skills early in their training. On the curriculum side, we welcome their ideas on how we can optimize their learning, such as adopting new technologies and gamifying learning.
Early on, our students told us they wanted to find ways to connect and synthesize the concepts they've been taught across their different classes. We used active learning workshops and other learning strategies to allow students to consolidate what they've learned and to see how this information fits together. These workshops deploy a multidisciplinary teaching team and near-peer teachers to give multi-layered feedback. Now, near-peer teachers strengthen our teaching as they are closer to that learning experience. They understand the challenges and they can use hindsight to guide their junior students.
Our teachers work closely with students to review content accuracy and provide pedagogical guidance to ensure consistently high-quality teaching. For example, in the clinical near-peer teaching program, we organize dedicated training sessions led by pedagogical experts, senior year students, and experienced clinicians who are passionate about bedside teaching. These training sessions play a crucial role in upholding the high standards expected for future medical professionals. I'm so impressed by our students' passion for advancing health sciences education. In addition to earning teaching awards from the faculty, these students' projects have also gained recognition from international education awards.
My involvement in SIMSE projects focuses on enhancing the essential skills for healthcare workers, including communication and empathy. When I ran a stoma care lab as a peer tutor, I asked students to wear a water-filled bag to simulate the experience of stoma users. Students responded positively and reported greater awareness of the challenges faced by the patients. To me, SIMSE was transformative because it empowered me to turn real-world nursing challenges into meaningful learning opportunities for the others, blending empathy, innovation, and active learning into everything I can do as a passionate educator.
I teach health inequality and empathy to our BC medical students. We want to ensure that when they graduate and treat patients, they consider how factors like a patient's living environment, social connections, works, or finances could impact their health. Through SIMSE, we can create close partnerships between students and teachers to research and design new ways of making learning more interesting and engaging.
ECO uses gamification to let students step into their patient's shoes and consider the challenges they may face when accessing healthcare. We designed this game to address a critical gap in medical education to understand the lived experience of vulnerable populations. Based on a board game format, players adopt the roles of underprivileged citizens as they navigate obstacles linked to their socio-economic status or other circumstances.
To build this game, we invited members of vulnerable communities to share their experiences and insight. By co-designing this project, we've taken ownership of our learning and developed relevant skills for our future practice.
We serve as Teachers Advisor of OE Thoughts, a student-teacher initiative under SIMSE. At its core, we aim to establish a knowledge exchange platform, fostering collaborations and public sensitivity in ethics and humanities.
As educators, our goal with Ethos is to cultivate empathy, critical thinking, and a deeper understanding of the human experience in medicine by engaging students in meaningful dialogue and activities. We encourage students to embrace and develop their curiosity, creativity, and communication skills for their own benefit, for their peers, and the next generation of healthcare professionals.
Ethos asks and answers the timeless questions in medicine, such as morality, ethics, and meaning, In considering these ideas, we hope it brings us closer to understanding ourselves as a part of the healthcare community.
We invite contributions from the community and are always astonished by the wide range of articles, essays, and creative narratives we receive. From high schoolers' essays to a medical student's experience of cancer, to submissions by practicing clinicians.
We also invite leading healthcare professionals to share their stories through our EFOS podcast. Their fascinating experiences remind us why we chose this medical path.
SIMSI is very meaningful and lets us change the landscape of teaching to create a better learning experience. Teaching is a prerequisite of being a doctor, so SIMSI gives us a good background and a chance to revolutionize medical education.
We are really proud to witness our students grow as educators, actively contributing to the advancement of medical education for future generations. I'm excited about what's next, both for them and for HKUMed.